The strangest phone call I ever answered began like this. Hi, I have some good news and I have some bad news. The good news is my husband died. I remember gripping the receiver stunned. Good news? And then she said, he's had Alzheimer's for the last 15 years. I lost him a long time ago. The bad news is I have to cancel my appointment tomorrow because I need to plan his funeral. That moment gutted me because Alzheimer's steals connection, memory, and presence long before the body is gone. Researchers have found Porphyromonas gingivalis, an aggressive bacteria from your mouth, in the brains of people with Alzheimer's. And Alzheimer's is a form of dementia. Long-term gum disease is associated with a 70% higher risk of dementia. Let me say that again. Long-term gum disease is associated with a 70% higher chance of dementia. We used to think that the brain was a fortress, but these bacteria can cross the blood-brain barrier, infiltrating the very place they were never meant to go. That phone call changed me because it revealed one simple truth we all overlook. What happens in your mouth doesn't stay in your mouth. I never meant to work at a dental office. I studied product design. I started companies. I was raising 5 kids. But when our office manager had to leave her job due to ill health, I stepped up to fill in. I started sitting in on CE, continuing education, with the dentists and hygienists, and I can't stay silent about what I learned. Nobody outside of dentistry understands gum disease. Not the patients, not the public, and at the time, not even me. Gum inflammation is the gateway to our bloodstream. When our gums bleed, the barrier is broken, and bacteria can enter our bloodstream in seconds. My sister's best friend lost her mom to endocarditis, a deadly heart infection that began with bacteria from her mouth. She left behind 8 children. Most heart surgeons today won't even operate until a dentist clears the patient. That day I learned oral infections don't just steal teeth. They steal mothers and they steal futures. With stroke, regular flossing is linked to a 44% reduction in deadly ischemic strokes. According to the CDC, gingivitis affects 60 to 75% of pregnant women. And untreated gingivitis leads to preterm birth and low birth weight. It's not just about protecting the mothers, it's about the baby's start in life. With diabetes, it's a vicious cycle. High blood sugar leads to gum inflammation. Gum inflammation leads to insulin resistance, and insulin resistance leads to higher blood sugar. Oral inflammation can worsen menopause symptoms, contribute to endometriosis, and men, listen up, even erectile dysfunction. Men with gum disease are 2 to 3 times more likely to experience erectile dysfunction. Why? Because inflammation destroys blood flow everywhere. Your gum pockets, they hold the secret. Have you ever heard your dentist call out numbers like 2, 3, 2? Those measure the space between your teeth and your gums. 2s and 3s are healthy, but when those numbers turn to 5s and 6s, that's the sound of your bone disappearing. Your gums are like a turtleneck sweater. When they're healthy, they're snug and protective. But when you don't floss correctly, they get stretched out, loose and worn. Bacteria move into that space, and your body responds by sending an inflammatory wrecking ball crew called osteoclasts. They dissolve the very bone holding your teeth in place, just to get to that bacteria. Your gums, they can tighten again, but your bone cannot grow back. I discovered that we were dealing with a design problem, and we needed to solve how to make flossing not technique sensitive. We floss for 2 reasons. 1, to go between the teeth, and 2, to prevent gum disease. Most people who do floss only do the first part and prevent cavities. But without getting underneath the gums, you're not disrupting the biofilm, and you're going to leave behind the very bacteria that cause disease. I discovered when we solve the problem, we need to clean the teeth, heal the gums, and detox the tongue. Because when we clean between the teeth, we remove bacteria. And when we stimulate the gums, we promote blood flow and healing. And when we clean the tongue, we reduce the overall bacterial load. Your mouth is home to over 700 species of bacteria. And every time you swallow, millions of bacteria go to your gut. Oral immunologists have shown that certain gum bacteria can actually mistrain your immune system by activating T cells that not only fight infection, but they could turn on you, infiltrating the very place they were never meant to go. Did you know brushing only cleans 60% of your mouth? That means you're leaving 40% dirty, the dirtiest 40%. Would you ever shower but deliberately skip your armpits or other cracks and crevices? Of course not. Your gums are the armpits of your mouth. Your gums are those danger zones home to sticky, stinky bacteria. Only flossing correctly clears them out. If our hands bled every time we washed them, we'd panic. So why, when we floss, do we shrug when our gums bleed? Flossing doesn't take hours. And it's not about perfection, it's about prevention. Not just more years, but healthier, more present years. It takes 1 minute a day to floss. 1 minute for your brain, your heart, and your gut. Because what happens in your mouth doesn't stay in your mouth.